How is prostate cancer treated? So the first thing is we would need to make a diagnosis. Once we make a diagnosis, then we would need to stage the cancer to assess the extent of the cancer and how aggressive the cancer is. So the first intervention is what we call a radical prostatectomy, which is basically to remove the whole prostate. If you're going to be doing it today, the best way to do it is a robotic radical prostatectomy, where it's a minimally invasive treatment where about 5 small holes are made in your abdomen and instruments are inserted into your abdomen, and these instruments are connected to arms of a robot, and with the assistance of the robot, the surgeon works at a console and they remove the whole prostate. The other option in terms of treatment of prostate cancer is radiation treatment. So basically you're using heat as an energy source to burn the cancer. And there's 2 forms of radiation we would use in prostate cancer. The one is called brachytherapy, where we insert radioactive seeds or pellets into the prostate. So these seeds would stay in you forever, but they give off radiation for approximately 9 months and they burn the cancer. The other form of radiation is where you get radiation from the outside. So you'd go for between 5 and 7 weeks every day and you sit on a machine, and for a few minutes you get radiation from the outside. So if we opt for radiation, depending on where you treat it, sometimes people use external radiation alone, sometimes we use brachytherapy alone, and sometimes we would use a combination of both the external beam and the brachytherapy. So if the cancer is more advanced, we would use hormone therapy, and also in addition to that we would use chemotherapy. The chemotherapy can be in the form of tablets, and sometimes they can be in the form of intravenous medications.
If you have been diagnosed with prostate cancer, it's important to keep in mind that many prostate cancers are slow growing and may not need surgery or radical treatment. Take the time to learn about the various treatment options. Make an informed decision by seeking advice from medical professionals and reputable sources.